So I'm here at Sharm el-Sheikh, and what we're really looking at is the intersection of all these conversations around climate change and health. And the point that actually the biggest impact across the world on climate change is going to be actually human lives and livelihoods. And when I look at all these panels, there is everything else except health on these panels. When do we actually get health to be at the center of the climate change conversation? When we get lives to be at the center of this conversation? This is really what I'm here to do at Sharm el-Sheikh. And AMREF Health Africa will be working with our partners to see what really should governments do and what should COP28 do to ensure that health is integral to the COP or to the climate change conversations, because it's about lives at the end of the day, lives of human beings, and those should be our concern. Climate change is about lives and livelihoods in addition to the planet. Today, indeed, 3rd of December 2023. It is a great day that we witnessed the first ever health day at any conference of parties on climate change. This really speaks to the false notion that climate change is only measured in degrees centigrade or Celsius or Fahrenheit. It is actually going to be measured in human life. It's going to be measured in the health of people who live on the planet. And therefore, witnessing the first COP28 Health Day, realizing the role that AMREF Health Africa has played in partnership with WHO and the UAE COP28 presidency, is a proud moment for us, because AMREF Health Africa has been in the forefront since COP27 at the Africa Health Agenda International Conference, whose theme was highly leaning towards climate change and health, towards convenings that happened at the Africa Climate Summit in Nairobi. After that, convening other sessions at the UN General Assembly and also Geneva at the World Health Assembly, and also convening a meeting in Malawi on the Africa Common Position on climate change and health, mobilizing ministers of health and their counterparts, ministers of environment, to actually realize that the damage of climate change is going to be measured in human health and human life. And today, to witness COP28 Health Day is the success of many years and many months of working together with others in the front line, young people, women, WHO, academicians, and anybody who's been in this front line. We hope and we look forward to a health day at every COP in the future, starting with COP29 next year. But most importantly, in the integration of health goals in the global adaptation goals, so that health can actually be part of the global stocktake, be part of the loss and damage calculation, and be part of climate investments to ensure that even as we work to decarbonize the health sector, as we work to ensure we reduce the use of fossil fuels and end the use of fossil fuels, we are also at the same time recognizing that it's no longer just a risk, it's a reality that the health systems is going to be impacted significantly by the global warming, as we are seeing with flooding, with extreme drought, with changing patterns of vector-borne diseases, with increasing waterborne diseases like cholera. Therefore, it is an issue of health, and health is truly the human face of the climate crisis.